neurology, physiology, and anatomy. All right, so for this next chapter, we're going to be talking about the neurotransmitters of the nervous system and what the associated diseases are with each neurotransmitter. So first and foremost, we're going to start off with acetylcholine. They want you to know the location of each of these neurotransmitters, where they're produced, and what they're seen in, what disease pathologies they're seen in. So first we have our acetylcholine. Acetylcholine is going to be located in the basal nucleus of my NERT. Okay, you might think you could get away with not memorizing the locations, but I'm telling you right now, this is one of their favorite questions, asking you the locations in which each of the neurotransmitters are made within the brain. So acetylcholine is basal nucleus of my NERT, all right? And it's going to be decreased in Alzheimer's disease, okay? That's going to be the key association that they like to talk about. And that's why sometimes treatment that we can give to Alzheimer's patients is acetylcholine esterase inhibitors, so that we can have an uptake or essentially an increase in acetylcholine within the synapse, right? Next is dopamine. Dopamine is going to be made in the ventral tegmentum or the substantia nigra. Ventral tegmentum is probably the main location that you're going to be asked about. But what they like you to know is that it's going to be decreased in Parkinson's disease. Okay, it's going to be decreased in Parkinson's disease. Next is GABA. Okay, GABA is our inhibitory molecule or neurotransmitter of the CNS. The reason it's inhibitory is because it allows for chloride to enter cells. Okay. So if you don't have GABA, you don't have inhibition, okay, because you don't have the ability for chloride to enter cells without GABA. GABA is produced at the nucleus accumbens, all right, and we're going to be seeing this in Huntington's disease. A decrease in GABA will likely be a pathophysiology associated with Huntington's disease, okay, so decrease in GABA is associated with Huntington's disease. Next is norepinephrine. Norepinephrine is going to be made in the locus coeruleus, and that's located in the pons, okay? They want you to know that it's located in the pons. That specific question I remember coming up, and I was pissed because I didn't know it. So locus coeruleus is what I memorized, but remember that that's located within the pons, okay? And what they will say is that the locus coeruleus is located in the pons in pigmented neurons, okay? So norepinephrine is released from pigmented neurons. Okay, so it's going to be a darker neuron substance, okay? And that's going to be released from the pons, specifically the locus coeruleus, okay? Don't get that confused with substantia nigra, because whenever they say a darker area, a lot of people would want to pick substantia nigra. But if they're talking about norepinephrine, they are also pigmented neurons. But that's lower yield, but I remember getting a question on it. If they're talking about the pons with pigmented neurons in the locus coeruleus, and they're specifically talking about norepinephrine, think about that. Next is serotonin. Serotonin is released from the Raphe nuclei. They love to ask about the Raphe nuclei. Make sure you know that. It's in the brainstem. And one specific association with this, although it will be coming up way later on, but I feel like I should bring it up for the serotonin, is that tetrahydrobiopterin, okay, so that's BH4, is needed for serotonin synthesis, okay, and we're going to talk about that later on in biochemistry, but I just want to make sure that you know that BH4 is needed for serotonin synthesis, and it's going to be synthesized in the Raphe nucleus, okay. Last but not least is glutamate. Glutamate is one of those, is the main excitatory neuron of our nervous system. They didn't have it in my book, and I thought it was just a complete mess because they didn't put it in. We got so many questions about glutamate, and no one sat down and explained it to me. So here's just the short understanding of what glutamate does. So once again, it is the main excitatory molecule of the CNS. And the reason it does this is by allowing calcium to enter through NMDA receptors. Okay, so glutamate helps calcium enter through NMDA receptors, which will lead to an overall excitatory response. Now, magnesium blocks the glutamate NMDA receptor, which can effectively cause a decrease in our excitatory response. Okay, so magnesium is going to inhibit the ability for glutamate to bind to the NMDA receptor, leading to an inability for calcium to enter, leading to an overall decrease in excitatory responses at the neuronal level, okay? Something that they can talk about is excessive glutamate, right? So if you have too much glutamate in the system, it can all bind to NMDA receptors, right? And lead to activation of it. But that will lead to a large increase in calcium influx into the cell. Well, calcium itself in large levels can be cytotoxic. So that can lead to neuronal death because of the amount of calcium entering the cell. And once again, can you think of something that can help stop this? Exactly, magnesium. Magnesium is going to block the NMDA receptor so glutamate cannot bind. There's a couple other things that I want to talk about in this video. First being the meninges. Just quickly, the meninges are separated into 3 layers: the dura mater, the arachnoid mater, and the pia mater. Okay, and overall, that's going to create the meninges that protect the central nervous system. The dura mater is going to be the outermost layer, and the pia mater is going to be like a thin fibrous layer that's directly on the brain, okay, or directly touching the central nervous system. The cerebrospinal fluid is going to flow within the subarachnoid space, and there's a lot of pathologies that talk about the meninges and where bleeding can occur within the meninges, which we'll touch on later on. Next is the blood-brain barrier. The one thing that you need to know about the blood-brain barrier is that tight junctions help make up the blood-brain barrier. And we already discussed what cell type helps make it as well, but I'll wait for you guys to think about that real quick. Exactly. We discussed that our astrocytes are going to help create the blood-brain barrier, okay? So, and that's going to be making up tight junctions, okay? So tight junctions is what helps create the blood-brain barrier. Lastly is the vomiting center. The one thing that you need to know about the vomiting center is the area postrema. It's located at the 4th ventricle. They can take a photo of the brain and show you it and ask you where the vomiting center is, and there can be multiple arrows pointing all over the place. Pick the one that's located near the 4th ventricle. That's going to be the area postrema, okay? And they can ask it multiple ways, but once again, if you are picking near the 4th ventricle or area postrema, then you are near the vomiting center site, okay? That's all before we get into the sleep physiology.